I am called Dr. MUGARURA. I am a surgeon at the level of senior consultant, and so basically my work is to see patients who have surgical conditions, investigate them, and offer them the most appropriate treatment. The topic that we decided to talk about today is cancer of the esophagus. And we have all heard about cancers, and each one of us actually wishes and prays that we never get these cancers, because we know cancer, in most cases, especially in our setting, cancer will have no cure because the patient comes in with late or advanced cancers. So that's why we decided to talk about these cancers. Today we are talking about cancer of the esophagus, but we will continue to talk about other cancers. And the reason why we decided to do that is to create awareness. So what is a cancer? A cancer is where the body cells decide to grow on their own. So they become independent, or they become, we can say, they become rebels, and they are no longer responsive to the body systems. That means now they decide how to grow on their own. And usually the problem with that is that they are going to overgrow, so there is increased growth of cells, there is loss of function because these cells have detached themselves from the rest of the body system. So these are cells that continue to grow, so there is purposeless growth, there is consistent and constant proliferation or increase in number of cells, and worse still, these cells can break from their origin and spread into the rest of the body, which we call metastasis. So that is actually why cancers are very difficult to treat. So you have cells that have decided to rebel against the normal body functions. They are useless in the body, they can spread in the rest of the body, and they are not easy to control because normally the body has a way of controlling cells. But these ones have become mad, if we can use that one. So when we talk about cancer of the esophagus, we are looking at cells within the esophagus that have decided to become independent from the rest of the body cells within the esophagus. So they are going to grow and multiply rapidly. They have ability to move away from the esophagus and spread to different parts of the body. But again, they also have ability to eat into the surrounding structures. The esophagus, or gullet in English, is a tube that connects the mouth and the stomach. So once you have finished chewing, you swallow. So that tube that takes food from the mouth to the esophagus, through the esophagus to the stomach, is what we actually call the gullet or the esophagus. So who is at risk of getting these cancers? So the most important risk factors that we are seeing or we encounter, especially in our region, is the alcohol, and there is a lot of alcohol these days, all sorts of alcohol, especially the spirits. So if you take a lot of alcohol, you are at an increased risk. If you use tobacco in any form, this could be smoking, it could be chewing it, as long as it is tobacco, it also increases the risk of getting cancer of the esophagus. And the other risk factor that we are seeing these days, we call it gastroesophageal reflux disease. So this is where you find that food moves up from the stomach into the esophagus. And normally this is what we call heartburn in English. Heartburn is okay, it's normal if you maybe eat a high carbohydrate diet, could be sweet potatoes, could be posho. If you eat that and you get heartburn, that's okay, as long as it clears in about maybe an hour's time. But there are people who get heartburn even when they have not eaten anything, or actually people who eat and when they sleep, food flows back from the stomach back into the oesophagus. So those are at an increased risk because the oesophagus is not supposed to have any acid in it. So if you have acidic food regurgitating or flowing back into the oesophagus, that will predispose you to cancers, particularly of the lower part of the oesophagus. There are other risk factors, including strictures. There are some people who ingest accidentally or intentionally inject some caustic substances like acid or alkali. There are actually people who ingest jik. Those chemicals damage the oesophagus and make it narrow, what we call a stricture. So those ones are also at an increased risk of getting cancers of the oesophagus. So it's very important that you look out for this disease, especially cancers, and this is what we call screening. Because as I have already said, cancers are not painful, they do not have any symptoms, especially in the early stages. And this is stage 1 and stage 2. And unfortunately, cancers are only curable in stage 1 especially, and some cancers even in stage 2. But once you're in stage 3 and stage 4, cure is possible but very difficult. So this is why we emphasize screening. Screening simply means that the clinician or the health worker is looking for a disease in a patient who does not have any symptoms. So you actually get the disease at what we call a subclinical level. It does not have any symptoms yet. So that is the only time and the only chance there is for any cancers to be cured. So how do we screen for cancers in the oesophagus? So there is an important test that we do, which we call endoscopy. And this is basically, it's a long tube with a camera on it and a light. So we put this patient to light sleep, not very deep. So it's light sedation, that's what we call it. So the patient, we make the patient sleep, and then we put this piece of equipment through the mouth into the oesophagus and also into the stomach and part of the duodenum if there is need. So this equipment helps us to look at the lining of the oesophagus and then of course the stomach and the duodenum. And this is direct vision, what we call direct vision. We all have, most of us will have smartphones, so you get a video. You can actually record a video like you would record a video of a friend because you have a camera and you have a strong light. And this same equipment, which we call an endoscope, also has some channels where we can pass some instruments and actually pick. If you look at an area which does not look normal, we are also able to take part of that area, which we call a biopsy, and take it to the lab and test it. And that is the only way you can confidently say that someone has cancer or they do not have cancer. So then, who is at risk? Who should actually go for screening? So if you are about 30 years and above, and you drink alcohol, and you use tobacco in any form, or you have history of ingesting any caustic substance, or if you have recurrent heartburn, this is someone who actually requires a screening for cancer of the oesophagus. Every year, we recommend at least once a year you go and have an endoscopy, and they look at your oesophagus and ascertain whether it has any problems. If it has no problem, that is very good, and that is what we always wish for. But if there is a problem, then we can actually detect it early enough. So that is what we recommend. And of course, how do we prevent cancer of the esophagus. So it's actually the reverse. So we discourage people from taking spirits, that is alcohol. There is what we call social drinking. So maybe a bottle of beer is okay for a day, but if you're taking more than one bottle every day, that is not healthy. So people who smoke, we discourage smoking. Smoking is one of those things that has actually been associated. It is associated with all sorts of cancers. So if you do smoke, you are at an increased risk of getting cancer. It could be cancer of the esophagus, it could be cancer of the lungs. So many cancers actually have been associated with smoking. So it is one of those things that we highly discourage. If you have recurrent heartburn, that also should be investigated, and you should seek treatment for that. So how do you know that you actually have cancer of the esophagus? Unfortunately, the symptoms that I'm going to talk about come in the late stages, usually from stage 3 and stage 4. And it is unfortunate that in our region, most of the cancers we get are in stage 4. So you have a patient who can no longer swallow anything, they have lost weight, they are dehydrated, and you make a diagnosis, yes, but the treatment options are minimal. So the symptoms normally appear in late disease, so you actually don't want to wait for the symptoms that I'm going to talk about. But the main symptoms are progressive dysphagia. So that means it is progressive, which simply means that your swallowing becomes increasingly difficult. So to begin with, you cannot swallow solid foods. You have difficulty for swallowing solid foods, and the liquids can pass. So you can drink water, you can take milk, you can drink porridge, but as the esophagus continues to narrow because of the cancer, it progressively becomes smaller, to the extent that now you have difficulty swallowing even liquids. You can't swallow porridge. You reach a point where you actually cannot even swallow your own saliva. And these patients are always spitting the saliva because they can't swallow it. So it is progressive. The swallowing progressively becomes worse. So that is one of the cardinal symptoms of cancer of the esophagus. Of course, the other symptom is that you can swallow food, but this food does not get into the stomach. So when you lie down, the food flows back. It's like if you have a glass of water and then you tilt it and the water pours. So we call that regurgitation in English. You swallow, whether it is milk or food, and when you go to bed or you actually take a nap, the food just flows back. So that is another. So it means that there is an obstruction or there is a blockage in part of the esophagus. So whatever you're eating or drinking is pulling within the esophagus. When you lie down, it just flows back. And some people get recurrent cough because whatever is flowing back can actually end up in the breathing system, in the airway, and that will cause you to cough. But worse still, you can have the cancer eating into the trachea. So now you have a hole that is communicating between the trachea and the esophagus. So if you swallow, the food will just drop into the trachea, and that causes coughing, like when you choke. So these patients, every time they try to swallow, they will cough. They try to swallow, they cough. So that actually means that there is now an abnormal connection between the trachea and the esophagus. And of course, we have a nerve which helps us to speak, which we call the recurrent laryngeal nerve. So some cancers actually eat into the recurrent laryngeal nerve, and then someone loses their voice. Someone who was speaking well is now speaking with a hoarse voice. So those are some of the symptoms that someone can get. So as health workers, we recommend screening. We use an endoscope into the trachea, we look down up to the stomach, and make sure that there is a problem. That is the only way, the only reliable way of screening for this cancer. So we recommend at least people who have the risk factors to screen at least every year. As Bethel Surgical Clinic, we are partnering with the Kigezi TV, and the reason why we decided to do that is to bring more health information to the listeners, especially in Kigezi region, because this is our region, and of course Kigezi region and beyond. And the reason we are doing it is we want to empower every one of us to be able to take care of our health. So this is just the beginning of more health related information, more health education. So just keep tuned in to Kigezi TV for more health education.